What's
happening?
happening? How are you?
I'm all right. I'm decent.
You said
I
what?
said I'm
You
decent.
decent.
I'm decent.
That's Friday Junior.
Just, you said what?
It's Friday Junior.
Friday, Junior. I don't know who for. I mean, for me.
Well, you know I work on Saturdays, so
Yeah. It's been a tough week.
I understand that.
Yeah. It's somebody that might have got you beat yesterday.
Uh-oh. Well, I know it's people out there that's worse than me. You just be saying that.
It wasn't even so much that she was worse than you, like, and I'm gonna put because it was pretty dope because she found me on TikTok and she did like this whole little 3 minute. She wanted to have this whole 3 minute thing where she like pretty much did her journey herself. Just talk about I'm pregnant. I found my doctor on TikTok. I'm trusting him. Like she went through this whole thing. She turned to the side profile, this thing sitting out like that. And she was just like, so I'm gonna show y'all my journey or whatever. And she showed it to me. I was like, well, how about we just talk about it? So Big Mouth, Mr. Big Mouth was like, I get on the thing and I'm like, all right. I was like, yeah, so this is it, talking. I was like, we about to go into surgery, blah, 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 blah. And so I'm getting there and I mean, like, I'm like, once I put like the ports in or whatever, once I put the ports in, it's like, all right, you got to do it now.
Mm-hmm.
And I was like, plus she didn't talk to all this shit. So it's like, but I mean, when I got down there, I was like, all right, it's going to kind of be like Colas where, like I just start plucking off fibroids.
Little
That
by little.
was like, she had really one dominant fibroid that was like, my God, massive. It was like this, like two of these.
Wow.
Like six. And it was like, even before I could get to her uterus, it was like literally, I put it in there, it was like this in my face on the camera. And I'm like, what the fuck? So I just start to cut it. But it's like when you cut through a fibroid, it's like cutting a rock with a hot steak knife. That's what it is. So, well, a little hot steak knife at that. So I'm like, shoot, knife. So I'm literally 3-4 hours just cutting through this thing just to get to her uterus, which was all the way messed up. It was like, it was twisted on itself, had a big fibroid. So just to get to it, I had to chunk this fibroid. I mean, it was, and all the while I'm talking to myself, like, what's your life about, dude? Like, what are we here for? Like, what's happening here? Like, I'm like, I know you trying to help people, but like, insurance ain't paying you for this. Ain't nobody gonna pay you no extra money for this. You just sitting your ass down here playing. Nobody's seeing this. Nobody's gonna give you nothing for this. You're not getting paid for this. But the me is just like, that's not what you're doing for. You and God see this. Just keep doing it. Keep doing it. I'm keep talking to myself like, dude, this. And I'm just like, at a certain point, I'm like, yeah, it's gonna work. I can see it, whatever. Like halfway through it, I'm like, I don't know what the fuck. I don't know. This shit ain't gonna work. Like, I don't like. It's just not working. Like, I'm digging in fiber. It's like digging in a tunnel, and you see more tunnel.
Yeah.
I'm digging in here, and I'm digging, and it's fibroid, and it's like, once I was like, damn, once I get this piece off, I'm gonna be good. I'm like, God, it's more fibroid. It just kept coming and kept coming and kept coming, and I was like, yo, why is your life this way? It's like straight up and down. Like, people are paying 15 grand for BBLs, and your black ass is up in here getting paid 1,000 for this. You know what I mean? For buying insurance. So what are you doing? What the fuck are you doing with your life? Like, all right, man. And this is what God called me to do. I ain't gonna complain. I'm just gonna do it. What it is, man. Keep doing it. I just gotta keep like encouraging myself, because that shit was horrible. It was 6 hours. It was every bit of like, I was in there for like 6.5 hours, and this is
Oh
supposed to
yeah,
be.
well, I know about 6 hours.
Oh, it was every bit, and it wasn't no blood loss. It was just me in there chunking and chunking away, and everybody, and like fortunately enough, I had really like a good surgical assistant kind of helping me put in instruments and stuff. Because if he wasn't there, I would have been like, oh my God. But it was tough. It was top. It's top. I would say top 3, maybe top 2 toughest cases in the past decade that I've ever had yesterday. And I'm just like, what the fuck? But anyway, nonetheless, let's get to the question.
But that's good. And what you from a patient's perspective is the reason we get to that point where it's that bad is because fear of what we have dealt with, like, just really will make you be like, nah, it ain't that bad. I'm gonna figure this out. No, it ain't that bad. I'm gonna figure this out. I mean, like I told you, when I was watching you and you were saying people walking around with studio apartments, I was like,
no,
is he talking to me? And I was like,
it's a legit apartment. That's not even being. That's like it's legit. It's like it's not. We talking about. It's bigger than a baby. Like it was bigger than it was. It's I'm shocked if it's not at least 7 pounds or more. It has to be at least 7 pounds. I'm saying more than 7 pounds. But it was unbelievable. And I kept thinking that in my head because she was like, I didn't heard it. She was like, everybody's gonna cut me vertical. I did want to be cut vertical. That is why I came. And I'm sitting up there like, well, I wasn't gonna cut her vertical. Well, let me take that back. I would never cut anybody vertical. I've made that. I would stay true to that. But, and this is the thing about the robot. Without that robot, I don't think it was possible to do that with a horizontal incision. I don't even think it's possible. Like, and that's the God honest truth. That robot was really the only way that I could do that surgery without cutting her like that. And I wasn't doing it, so I was like, you got to do it. But Lord God, thank you. I've asked enough. I've fibroid slayer. All right, let me cool out. Let me chill out, man. I'm doing too much.
You signed up.
I'm doing too much.
You understood the assignment.
I was like, man, they are finding me.
Yep.
They find my ass. Like, I'm like, okay.
Yep.
It's cool, man. It is what it is. Like, so I'm happy. She
sending them
I don't think it don't get no harder than her. She was like, this prepared you for like when somebody come harder than me. I was like, Mama, I don't think God have it in his spirit to make it no harder than
well, that's why we're doing this, so people will go earlier. You got somebody in the truck today.
Jesus Christ, please.
Let's not wait any longer. Like people who like me that waited years and years and years. So yes, that's why we do this, so people are more confident in making a decision and picking the right person. So welcome to the Q&A. Obviously, we had a whole conversation. Sometimes we be forgetting y'all here, I guess. But
was it a myomectomy? No, it wasn't a myomectomy. It was a hysterectomy. Myomectomy would have been even more of a nightmare. It would have been even more of a nightmare. I could have done because honestly, that fibroid wasn't really ingrained into her uterus. It was actually damn near pedunculated, which is the craziest thing. And I'm gonna show it. I'm gonna show pictures of it. I'm gonna show like what I saw when it's gonna be pretty cool. Like we kind of, between me and her, kind of documented the whole thing. So I'm gonna post her video of like her talking with herself, and then like the pre-op, and then what I saw, so people can like appreciate what I had to do, and like show the actual specimen. Like literally, my hands were like this around this thing. It's like it's bigger than the NBA regulation basketball. It's bigger than that. So it was monstrous. Nightmares.
Is her butt scratched up?
Huh?
Is her butt scratched up? Just me.
I think you just had a little man come to scratch your ass in the middle of the night or something.
No. I woke up on fire, so that was definitely.
I don't know what the hell. And I really just think that was you sliding up the thing. You just had a straight, ugly ass, like couple rug burns on your ass. I'm sliding up the bed.
Yeah, you did that shit.
Yeah.
You definitely did that.
I take that.
They've healed well though. It's like the spot is like that big now. 3 of them though, but they small now. All right. So if you want to join the live, because I had somebody reach out and said that they want to join, you are more than welcome to send a request. If you have questions tonight, please put them in the chat bubble that has the question mark in it. Not where it says add a comment. Talk to each other using that bubble. But if you want to submit a question, put it in the question mark. Put it in the bubble that has the question mark in it. And then also, of course, people submit stuff to me throughout the month. So I'll be going back and forth, back and forth, back and forth. So do you have a request to join though? Because
yeah, I do. Hold on,
okay.
Somebody.
Because I definitely told them, yes, we will pick you up. So.
Hey, how you guys doing?
How are you, man? Good to meet you.
Good to see you. I am fine. Chloe, you always come on my page. Probably not this one, Nanny Lolo, but Loretta Baker, and I talk back and forth to you. Here's what I'm saying. Do we have anywhere where we can donate to you? Anything? Do you have a fund, anything set up? Because you're doing this out the goodness of your heart, and we need some type of donation. Because I love to give money. I got plenty of.
Nobody really asked me about that. That really touched my heart. I appreciate that.
Yeah, it's time.
I'll give you like my Zelle or Cash App or whatever. And again, if anybody looking at this, I'm not saying any of this stuff or requesting anybody send me money. I work hard. I do well. I do appreciate my kids appreciate donations because they.
It's time. It's just time, because they going out buying Beyonce tickets that cost $4,000. They need to give
I be having people to come in. They like,
okay.
They be like, man, if insurance ain't covering it, I ain't doing it. They coming in there with Louis bags and fresh BBLs. I'm like, you just went and paid $10,000.
For those of you. Okay, now that I'm on the air, I'm live. You all that come to see him and you got a Louis and it ain't no rerun, whatever you call it. I don't know what you call it. Okay. If it's real, you need to give him more money than that. Okay. Because I am following you simply because of Miss Red here. Because that's when you first got on and she went through the process and I got to see everything. And so therefore, I know what you can do because I've heard her talk about her story, okay? And so that was so impressive to me to have you do your story live. And I've been following you ever since. And so I'm so glad that I caught you. I ain't got no fibroids. I'm so glad, but if I did, I got some other things I've been texting you about, okay?
I'm happy to help.
I need me a good doctor, okay? I can't find no good black doctors. I want me a black, brown, or whatever. I don't want no white man, okay? Whoever looking at this, if you white and you offended, I apologize.
Yeah,
I just
apologize.
I want
you don't
all
have to
people.
apologize.
And okay, I'm in California,
It is. I didn't have people.
it's hard to
fly
find,
from California to come in.
Okay, so anyway, I just want to get on. Thank you for letting me come on because we need to give you some money. So everyone that's hearing this, we need to set up some type of fund, Brid. Okay, I don't know how we're going to do it. You do whatever you want so that we can donate.
All right.
Send me your cash app, because I love giving money because I'm always blessed, okay? You would think that now that I had billions of dollars, okay? But the more I give, the more it gives.
And
it just comes back to me, and so I give, I called the radio station the other day and asked them, I said, listen, I want to give some money. She said, well, I don't know how you going to do that. She ain't got back to me yet. I wanted to give this money to a new mother that had just had a baby. And she ain't got back to me yet because she said, I know she's busy. And I've been texting her. But I said, somebody need this money, okay? I'm a giver, and I know the more you give, you know, and
Yeah.
that's an old Christian song, you know what I'm trying. But I ain't into nothing old, okay? I'm into everything that's awareness, that's good, that's joy, and that's pleasurable now while we here on this earth, okay? So, Miss Red, set it up, baby girl, so people can give. And you that are on this line now, and y'all going in there with Gucci bags and all that, because I'm past the Gucci stage now. I don't even buy that kind of stuff no more, okay? But anyway, I did once upon a time. But I ain't giving nobody no $10,000 for no damn purse. Shit. You crazy. Not now, you know. So I'm leaving a legacy for my children, you know. I'm buying Nike stock. You know, I'm buying that kind of stuff. You know what I'm saying? Because as you get older and you mature, you understand what to do. Okay, so y'all can DM me, you know, and you got anything that I need to say to you? Because I am the best in the West, California. Nanny.
I got you. And I
Nanny Lolo.
didn't forget about, I know
Thank
we
you,
talked the
guys.
other
I
day.
appreciate
I'm
you.
going to follow up with him separately about your conversation.
Yeah.
Our conversation. Okay.
So
I'm
Nanny,
good.
Nanny Lolo,
Yeah,
from the
I'm
bottom
good.
of my heart, swear, I
Good.
really appreciate it. Thank you very much. Thank you.
I know you do. I know you do. With your fine ass. I'm so glad I'm old. Look, here's my bonus daughter looking at you.
Never a dull moment.
You can say
I can say that because I'm old, right? I can say that. The young ones trying to say it too. They trying to get in, slide up in your DM. I know they trying to slide up in there. You know what I'm saying? But hey, I'm a grandmother and I'm proud of it. You know, back in the day. Well, anyway, let me get off the line now. I don't need to be saying all this kind of stuff.
I'm gonna give my stuff to Cola.
I'll talk to y'all later.
Like y'all can reach out to her. I appreciate it. Thank you, man. Thank you.
I'm damn near his personal assistant.
You're so welcome.
Point,
Thank
so
you. And you sure are. Yeah. You exactly are. Yes. And y'all in Chi-Town, right?
Midwest.
Okay. Yeah. Okay. Yeah. Well, I ain't nannying no more. So anyway, I can't visit Chi-Town right now because I'm going over there. You know where all them rich folks going? All the black rich folks going? What's it called?
You going to Dubai?
Dubai.
Oh yeah, I got.
Yeah, I'm finna, you better
go get your cruise. I ain't mad at you.
I don't do long flights. Y'all tell me about it.
That's right, honey. I gotta go.
We talk to you soon. Keep tuning in, please. Okay.
Thank you.
And thank you so much.
Okay. You're so welcome. Bye bye.
Man, she brings up a good point. I appreciate that though, because like I don't ever ask for bread or whatever, because that's not what I do.
She's genuine because she did message me about that, and she did message me something else, but I'll talk to you about that later. But she definitely meant it, because she definitely messaged me, and that's not who I was saying was gonna come on. It was actually somebody else. But she definitely messaged me that same thing. What's your handles or whatever?
So I'll give it to you. But that's like I say that to myself all the time. It's just like I already know it comes back to me, because it's like, you know, just from a spiritual standpoint, like I know these sacrifices and the things I do, like people like, you know, how like you rolling around Chicago and you know, you like you're not scared or whatever. I'm just like, man, I'm covered. Like I do what God asked me. I'm healthy. You know, I feel good. I don't look my age. Like I just like I feel the spirit, because like I'm doing what God tell me to do. So, for that's blessing enough for me. You know, he keep me safe, keep me protected, keep me healthy. Is like, man, I'm gonna keep working and doing what I'm supposed to do for him. So, but that's what's up. But she speaks to another point as far as like, you know, these gynecology or these OBGYN deserts. If they're California, like Southern California is a huge one, where I get people calling me from there. It's multiple different cities like throughout the country where it's like, you know, I know that there are major problems, and it gave me an idea of really what I want to do, how I want to impact the world or the country. My next phase is like up and giving deep thought and starting like a minimally invasive like surgery institute, where like these doctors come in and I start teaching them, because I can't operate on everybody. But if I start teaching, some of these doctors like my techniques and how to really approach women and what they're going through, then that's going to be my impact. So I'm about to start working on that.
That's what's up. All right. Do you have Anybody that wants to join?
No, there's nobody that want to join. I think it's like question. You see these questions too, right?
Yeah, I see them. I just want to make sure that nobody, because I told her I would be looking out for her. I don't remember her screen name right now, but all right. So first question in here, is your website back up? I was trying to go on earlier this week to schedule the consultation because I will be in Chicago in April. I have 4 to 7 fibroids. The biggest one is 5 millimeters per transvaginal ultrasound. Her symptoms are pain, heavy periods, bloating, etc., etc.
Great question. And it is like, so right now, if you go, it says under construction. You can send your information and to my email. So I got a new email address. I got a new bunch of everything that's being started now. So the plan is to get up tomorrow. I don't think it's going to be finished tomorrow, but Monday by the latest, it'll be up. But if you go now, you can at least put your information in, reach out to me, and then I'll respond to you. But website will definitely be up by Monday. But go to it now and at least like put your concerns and information so I can make sure that I log you in and respond to you.
All right. This is submitted. I'm gonna go back and forth. If you have a hysterectomy and no longer have a period, how will you know when you are in menopause?
Great question, actually. For some women, you won't, because bleeding obviously is one of the biggest or the most obvious signs of menopause once you stop having periods for 12 consecutive months. But if you don't have a uterus to have periods from, then you don't necessarily know. And so the answer to that would be symptoms, right? For some women, they don't really have symptoms, or they may have mild symptoms. So it's harder to tell for them. But when you start to feel hot flashes and vaginal dryness, those may come. That will indicate. But you also have perimenopausal women, meaning women who their ovaries are starting to decline, also have menopausal symptoms. So the actual stop working, the cessation of function of your ovaries, you never really are going to tell if you don't have a uterus. I guess an answer to your question, unless you start running labs. But it's really not something that you really should be trying to search for or look for. It's nothing that's going to impact your longevity of life or anything that's going to be significant. What I say always is look at the symptoms, treat the symptoms. So if you're having hot flashes, vaginal dryness, some significant mood swings, those types of things, then see your doctor about it, and then start looking into treatment options. Don't necessarily worry about if this is menopause or this isn't. Just really trying to kind of treat your symptoms. That would be my answer to that.
All right. Dr. P, what is your opinion on uterine embolization?
I am I'm completely against it, right? I just had somebody in my DM that, and this is what you all do. I'm gonna tell y'all, I'm just kind of be transparent with y'all. It doesn't necessarily anger me, but it frustrates me. So when y'all DM me and say, I'm having surgery on Wednesday, it's Monday, what you think about this? Or I had surgery 2 weeks ago. Did they do the right thing? Does my opinion really matter at that point? It doesn't. Like, you have to ask me these things before so you can make an informed decision. Even if I'm not performing your surgery, it at least gives you some insight to say, hey, if things aren't going right, then you may need to seek some second, third opinions and like do a little bit more research on your options. But I legit had a woman that it was in my DM that was like, I just had a UAE. I reached out to you a couple weeks ago. You didn't answer, but I just had the UAE. What you think about it? And I politely told her that I'm totally against it. I personally would not recommend uterine artery embolization, uterine fibroid embolization. They're the exact same thing. UAE, UFE, they're the exact same thing. I would not recommend it to my mama, my sister, my auntie. That's the question that you ask your doctor. Would you recommend this to your family? what would you recommend to your family? And I'm telling you out my own mouth, I wouldn't tell anybody in my family or anybody that I love to get those procedures. If you got them, I'm not talking bad about your doctor. I'm not talking about bad about you. If it worked for you, God bless. I'm not saying, don't say, oh, I hate it. Like, I'm not. If it work, whatever works for you, God bless. But for me personally, my patients and the people that I work with in my family, I'm not recommending it. Why is that? The reason being is because uterine fibroid embolization is a procedure in which a interventional radiologist, which is a radiologist that specializes in kind of like internal type procedures, and they map out your fibroids, and then they go map out your fibroids through a scan. They go through your groin, and they pass a wire through your groin, and they inject molecules that will stop the blood vessels to your fibroids. The problem with that is that when you stop blood flow to anything, it is usually painful because it causes something called ischemic necrosis. So for instance, if you were to sit on the toilet for too long or sit on your hands for too long, you know that tingly feeling? That tingly feeling is blood not getting to, and that's hypoxia or lack of oxygen to tissue. If you get off the toilet or you get off your hands, the blood comes back to it and the tingling goes away. But when you have fibroids and you cut off the blood supply to them, there's no return of the blood flow. It's designed to stop the blood flow to them, to kill them. So that pain is persistent. So for me personally, I've seen multitudes of women that have UFEs. And if you gave me, I've seen well over 100, but if I get 100 patients that have had UFEs, 90% of them will have a negative opinion about it. It may be 5 or 10% that will say, all right, hey, I'm doing well after my UFE, but an overwhelming majority of those patients have problems with it, which is why I don't personally recommend it, because it causes pain and it just does not work very well. It doesn't accomplish the goal that you're trying to accomplish. And with that being said, I have pictures of what a UFE looks like on the inside. So everybody that talks about, oh, it's this, it's that, or whatever, ask them, do you know what happens or what it looks like? They're going to tell you no. I personally have operated on women that have had UFEs and have necrotic, horrible, nasty looking fibroids because it causes something called ischemic necrosis. And you live with that inside your body for years and years and years. And I would not want that for any of my family, my patients, or whatever. So that's my personal opinion as somebody that is an expert in fibroids, that has seen fibroids, that has seen UFEs, that have seen this stuff. My personal opinion and recommendation is I would not tell anybody to do it. However, you definitely have many doctors, a lot of which are not good fibroid surgeons, that will tell you that it's a great option. And a lot of the reason why they tell you that is because they can't really operate on it. It's a way to treat it without them having to go to a difficult surgery that they can't do, and treating it and kind of really pacifying you. But it's not really them treating it effectively to the point that it's going to accomplish your goal. So hope that answers it for you. I hope everyone that is thinking about UFEs and that DMs me about it actually looks and listens to this, because that is my complete breakdown about UFEs and my personal opinion about it. I don't recommend it. Is it an option? Yes. If you listen to the American College of Obstetrics and Gynecology, which I abide to, they list it as an option, right? And I don't take options away from anybody. So if you came to me as a patient, anybody come to me as a patient, if you ask them, they will tell you, he puts UFE on paper. He puts UAE on paper. I do put that. I show you what it is. I give you my personal recommendation, and then I let you make an informed decision. But I don't take it from you. If you, at the end of the day, that's what you want, and you like, Dr. Johnson, I don't give a damn what you talking about. UFEs are the shit. God bless you. Go right ahead. I'm no judgment. But if you're asking my opinion as an expert, I say no.
All right. And then just a related related to UFE, can you have a myomectomy after a UFE if the fibroids came back?
You can. It's a nightmare. It's a nightmare because they're soft. The fibroids are soft. They're just have this nasty necrotic type of material. They don't have well-defined borders. Yes, you can have a myomectomy after. It's a difficult surgery. But yes, in answer to the question, yes, you can. And I have pictures. Anybody who wants to see pictures, like TikTok will ban my pictures. And it's crazy. You could put Gawk 3000s on the goddamn internet, right? And you could put, some of the nastiest, craziest stuff on there. But I'll put a picture of a fibroid and
you get reported.
The world is a fucked up place, man. I'm like, this shit crazy to me.
Yeah.
It's unbelievable. I don't.
Earth is ghetto.
Crazy. Unbelievable.
All right.
Somebody else want to get on here,
yeah, I was going to say, if you just joined it and you want to request to join the live, please go ahead and send a request to Doc P, because I saw somebody in the comments on the screen say they were joining.
Get pregnant with fibroids. Absolutely can.
So you said somebody requested to join?
They did. I'm not sure. I was just answering whoever asked, can you get pregnant with fibroids? Don't be scared. Whoever said don't, there's no reason to be scared. Knowledge is power. If you're knowledgeable and you understand your options, there's no reason to be scared. You just have to understand what's happening and get with somebody that you trust that's going to break things down for you. Once you with anything in life, if you have more understanding and more knowledge and you have someone that actually gives a shit about what you want and what you need, then it should take some of that fear out of it. Hold on, let me see what this is. Oh, you said she was the last question.
Hi.
Hold on 1 second. Hey, well, if you was the last question about the UFE, don't do it. I'm telling you, don't do it. Like, I don't know what else you want me to say. Don't do it. Period. But that's just me. You don't have to listen to me, but I would personally. I'm sorry. How you doing? People just be asking questions. I'm sorry. How are you? I'm sorry. That was rude.
That's all right.
What's your name?
That's all right.
What's your name?
Danielle.
Danielle. Pleasure to meet you, Danielle.
Can you guys hear me okay?
Yeah.
Okay. All right. A little nervous because I don't usually do this.
It's okay.
But
we don't fight, Danielle.
Okay. But I kind of feel like I'm at my wit's end, but it is what it is. So I was diagnosed with fibroids in 2019. And what was visible on the ultrasound were 4 large fibroids, measuring at 9.5 centimeters, 7.5 centimeters, 7 and 5. They are now down to 8.5 centimeters, 6 centimeters, 5 centimeters, and 4 centimeters. I'm told they're in the uterine lining and not in the cavity.
Okay.
And I have tried natural remedies that they haven't fully worked. I mean, the fibroids have shrunk, but I'm told that's because they have now become calcified, and that will sometimes cause them to shrink, but they're still fairly large. Doctors are not trying to blame fertility issues on the fibroids, just because they say it can be a number of things. And so I would soon to be scheduled for an open myomectomy.
Okay.
End of March or beginning April, because my blood work came back that I am more anemic than they thought. I mean, I've always had low iron, but now it has been diagnosed as anemia, so I would have to begin iron infusions before surgery in order to prevent having to get a blood transfusion while on the operating table.
Okay.
So that's like all new to me, and there's a risk of bleeding out. So all of that tied in, and I'm told the fibroids are too large and too calcified for a laparoscopic surgery to be done.
Okay.
and I'm in Canada.
Gotcha.
So.
All right. So you said a mouthful. Let me address everything you just said. So I just kind of took a mental Rolodex of what you said. So number one, you talked about like the size of your fibroids, right?
Mm-hmm.
And this is a misconception that people have, where if you get an ultrasound, you get a different number, and it's looks like it's small or whatever. Your fibroids didn't shrink.
Okay.
Right? What happens is that if I send you to X person for ultrasound, and they get a number. If I send you to 5 more people to get ultrasound, you're going to get 5 different readings on the same day. So the way you hold the probe, how much you press, who's reading it, how they angle, what type of day they having, if they do it, that dictates what it is. Fibroids typically do not shrink, right? Unless you have been on the very few medications that we have that are going to shrink them. Lupron is one. There are a couple of other ones that are very harsh medications that will cause fibroids to shrink temporarily while you're on them, but once you get off of them, they get back to their normal size, right? So your fibroids did not shrink. Your largest fibroid is 9.5 centimeters, maybe 8 centimeters, somewhere in between there, which is about this big. It's about your largest one, and they get smaller from there incrementally.
Right.
But so I don't want people to get hung up on like, oh, bigger, smaller is bigger, what have you, because it just they're the same size. The other thing that you said was as far as being in the cavity, but in the lining, right? So that's a little bit of misinformation that I believe that you got. When you say lining, the lining is the cavity, right? So the endometrial lining is the cavity. So whether it's touching it or it actually encroaches into the cavity, when you tell me anything about lining, that means that those fibroids are deep within your uterus, right?
The terms that were used were lining and wall.
So your lining is the lining of your endometrium, right? Whenever I hear the term lining as a gynecologist, means your endometrial stripe. So if you heard touching the lining, that means it's submucosal and it's pushing into the cavity. Lining and cavity are synonymous.
Okay.
Right? So if we had an ultrasound, maybe it's really close to the lining or touching and not pushing into it, but it's very close. Regardless of the fact, the surgery is going to still be the same. You also said about fertility and fibroids. Really, as far as fertility is concerned, there are multifactorial things that control fertility. It's not just fibroids. Is it true that women with fibroids overall have a increased level of infertility as opposed to women without fibroids? Yes. That does not mean that women with fibroids don't have babies. I've delivered many hundreds of women with fibroids where I go in, I see actually C-section, see fibroids on the uterus of them and pulling babies out, right? So it's not just you because you have have fibroids, or even large fibroids does not necessarily mean that that's what's causing infertility, right? Because you should be able to get pregnant. Carrying a normal pregnancy should be the problem, but even women with fibroid, you should be able to get pregnant. Sperm goes through the cervix, goes through your uterus, meets the egg, the fallopian tubes, come back, implants into the uterus, right? That can happen. The other thing that you said was as far as the types of surgeries and laparoscopic surgery for fibroids. And I say this all the time to women, that fibroids, for me, as a laparoscopic surgeon, as somebody that specializes in robotic surgery, I am not a proponent of laparoscopic myomectomies. I used to perform them all the time. I don't believe in them now. Reason being is for a couple of different things. Number one, when you perform a laparoscopic myomectomy, you lose your ability to palpate or to feel, right? Meaning all I could do is see things. They mentioned 9, 8, 7, 6. Those fibroids you're going to be able to see. But I guarantee you that you have fibroids that are in there that are smaller than that, much smaller than that. Give me one quick second. Hello. The trial run is over. 309 ready. Okay. All right. I might have to go deliver in a second. We're gonna have to pick this back up. Okay. But Jesus Christ. Sorry about that. So that was, as far as delivering is concerned, when you have a fibroid surgery, right, you are obligated for a cesarean section. You're going to have a C-section, especially with the fibroids that you're talking about is even close to the uterine lining. Even if it's not, if a doctor hears that you had a major fibroid surgery, whether it's in the cavity or not, they're not going to give you an opportunity to deliver vaginally. So it doesn't make much sense to do a laparoscopic surgery with these small incisions, not get all of the fibroids, and you have to have a C-section on top of it, right? It just doesn't feasibly make sense. It makes more sense to do an incision that's low to small that could be used for your C-sections and have the added benefit of removing all of the fibroids that are in your uterus. Got it? So that's my personal recommendation to anyone. The problem is that physicians are not skilled enough to do horizontal incisions. They're doing vertical incisions to do these myomectomies, which is the problem. All right, you should not have to do a vertical incision to fix what you're talking about. You should do a small horizontal incision that could be reused for your C-sections in the future. Last but not least, the good thing, and that's for because I've had multiple people call me from Canada. The hospital that I am at now actually works to make it affordable for people with no insurance. That didn't happen before. So for everybody that's in Canada, if you wanted to come to America to get surgery or whatever, the hospital that I'm at actually works with patients that are either uninsured, which Canadians would be considered that, to work with you to actually make this extremely affordable, because I have patients that are in America that don't actually have insurance, and I can't turn down anybody at this particular hospital, which is why I'm there. So it is an option. But all of those things being said, as far as also with the blood count and things, I've never delayed surgery for blood counts. If I have to give a transfusion the time of surgery or what have you, I would do that. You're bleeding, you're having those problems. That's the reason why we need to do the surgery. You're not going to stop bleeding. So prolonging it to optimize you doesn't really make, for me, a lot of sense. I don't do that. I just, I do the surgery and I deal with the low blood level at that time. So okay. I think that was all of the things that you talked about. Did I miss something?
That was it. Thank you.
Be very comfortable with them, with your doctor before you have surgery. Be very comfortable in the fact of your fears, your apprehensions, and talking about them, and letting them being very transparent about them being sensitive to the things that you want. Also, their approach to surgery, like, hit them with like, well, what happens if this happens? How's your approach to this or whatever? See how confident they are in talking about those things. How likely is it that I could end up with a hysterectomy? Have you ever performed a hysterectomy because of too much bleeding? Have you ever performed a hysterectomy because you said there were too many fibroids and it wasn't worth saving? Have you ever performed how many hysterectomies have you performed in your years of going to do a myomectomy and end up a patient with hysterectomy? These are very important questions that you want to ask to feel very comfortable with your surgeon. If you're comfortable with those answers or what have you, then an abdominal myomectomy for what you have makes sense. I don't know too much about the rest of your history, age, and all those things, and how long you've been trying, but an abdominal myomectomy makes sense. But an abdominal myomectomy with an incision that is going to be reused for your C-sections, that's not vertical, that is going to be something that's going to be one that you are going to have less pain for recovery, and not, high risk of infection. It's a lot of things that, you want to look for as they plan out your surgery. Okay.
Thank you.
You're welcome.
Thanks for joining.
All right.
Thanks, Carl.
No problem.
Bye.
No problem. Okay, so do you want to end it?
Yeah, so we can get back on there if everybody is one. This is probably gonna be like 15, 20 minutes, and then I can hop back on. But we can end this real quick and then come back if that's okay.
Yeah, I could do either one. I'm good. I could do either one. We could either end it and do, well, not next week, but skip a week, or we could do it back tonight. I'm not doing anything.
Yeah, we can do it back tonight. I'll be for everybody's on here. If y'all want to hop back on here, in about 20 minutes, I will hop back on here.
Yeah, because all he do is catch the baby. No, I'm just All right, now I'll see you in about 20 minutes. We'll be back, y'all. We'll be back.